Welcome to the Sidecar Sync podcast, your home for all things innovation, artificial intelligence, and associations.
Hello, everyone, and welcome to today's episode of the Sidecar Sync podcast, your home for all things innovation, artificial intelligence, associations, technology, and probably everything in between. My name is Mallory Mejias, and I am one of your co-hosts along with Amit Nagarajan. And today we've got an interview edition of the Sidecar Sync podcast lined up for you. We're going to be answering the question, what happens when a medical student decides to build AI instead of practicing medicine? That's exactly what today's guest did, Dr. Nicola Sahar. He is a Canadian physician and health tech entrepreneur who co-founded Semantic Health. After witnessing firsthand the heavy administrative burden placed on clinicians, Nick led the development of AI-powered tools to enhance medical coding, auditing, and clinical documentation. In 2023, Semantic Health was acquired by the American Academy of Professional Coders, or AAPC, marking a huge milestone in the adoption of AI in healthcare operations. Today, Dr. Nick Sahar remains an active voice in the healthcare AI space, focused on building tools that support clinicians and improve patient care. So what are we going to talk about in this conversation? Well, of course, we're going to talk about how Dr. Nick Sahar went from medical student to AI entrepreneur, ultimately selling his company to AAPC, and what this acquisition tells us about associations leading innovation rather than following it. We will hear his thoughts on AI replacement fears in medical coding, a profession that does seem a bit vulnerable to AI, and why he believes it's about augmentation, not automation, and what happens ultimately to professionals who don't adapt to AI. We talk a lot on this podcast about how important data privacy and safety is. I can't really imagine an industry where data privacy is more paramount than healthcare. So we're going to talk about that with Dr. Sahar. And then we're going to get his perspective on why he believes AI will be one of the most impactful technologies ever in our species' history. And ultimately, why associations are uniquely positioned to guide members through this transformation. Everybody, thank you for tuning in to today's episode. Please enjoy this conversation with Dr. Nick Sahar. Dr. Nick Sahar, I should say, thank you so much for joining us on the Sidecar Sync podcast. As we kick off the episode, I'm hoping that you can share a little bit about your background from medical student to now, where you've been, where you're going, and kind of everything in between.
Yeah, of course. Thank you so much, Mallory, for having me on. As you mentioned, I did start out as a medical student in Canada at the University of Toronto. And I think from week one of med school, like just jumping in, I got interested in the tech side of things. At U of T, they have a huge AI kind of department with a lot of the grandfathers of AI actually started out there, like Jeff Hinton. And so I just got sucked in from week one into the AI space, and I just dove in. So I didn't have an AI background before. I knew how to code from my undergrad days, but really in medical school, like one of the things that I started doing was looking at clinical natural language processing, which is how do we build like machine learning and AI models for clinical text, so patient text. And I started doing research on those topics. So I joined a lab that did AI research back in, I would say, like 2016. So a long time ago, before ChatGPT came out.
Yeah.
And I started looking at how do we build these models so that they can better understand clinical text and better be able to uh, pick out important pieces of information from our clinical notes, like diagnoses or procedures or things that happen to the patient. So that was happening on the side. I did my medical school training, but really, as I was going through med school, I became like a lot more interested in this technology side than what I was doing in medicine. Um, so at some point, I did a program called the Next 36, which was it's designed as a program to bring Canadian students together on campus every year, and essentially put you in like a dorm for one summer, and then your whole goal is to build a startup. Find 2 or 3 team members and just build a startup. And most of the startups don't end up making it past the program, but really the goal is to kind of put you in that environment and give you the energy and the inspiration to actually like have the belief that you can build a company. So I went through that in my second summer of medical school, and then I went back to the hospitals and rotations, and I just couldn't like get that experience out of my head at the end of the day. So very slowly over the next like year and a half, I've built a lot of conviction over starting a company and building my own thing. And so I was rotating in the hospitals, like working in the different specialties and the fields, and then really paying attention to problems and challenges that I was seeing and where technology and specifically the AI that I was researching could be impactful. And slowly but surely, I kind of got a lot more clarity and vision about where I would start. And it's really, really in the back office of healthcare. It wasn't in the front office. There's a few reasons for that we can dive into, but the technology as I saw it was still early in AI, but there was a lot of manual and kind of error prone workflows that were happening in the back office in the revenue cycle or health information management space that I thought we could apply the tech to now to create huge impacts to help people on the ground augment how they're doing things. So we started with medical coding,
Okay.
which I can get into a little bit later. But medical coding is essentially the process of a hospital submitting a claim on behalf of a patient that
Okay.
summarizes everything that's happened to that patient in during the hospital stay. So what are all the procedures that the patient went through? What are the diagnoses that they've been diagnosed with? We have to accurately capture that so that the hospital can get accurately reimbursed for what they did. And the way that happens is usually a team of people called medical coders are reading through all of the clinical notes that a doctor will have typed for a patient. And based on that, they create this claim. So we started to apply AI to that process to help augment these medical coders. And that was the initial seed of inspiration for the company. And to make things super short, I didn't end up doing a clinical residency, and I just dove headfirst into this company and I built it from 2019 until acquisition by AAPC, which is the American Association for Professional Coders, in 2023. So I will stop there. I
I
know that
mean,
was
what a
a lot.
fascinating story. No, it's so crazy, right? How life takes you on journeys that you could have never imagined. You went to medical school thinking you'd be a doctor, of course, and you are a doctor, but you were
Yeah,
led on this different pathway through that challenge. I think you mentioned it was called the Next 36. I
yeah.
have to ask, were the seeds for Semantic Health planted in that competition, or did the startup you come up with, was it something totally different?
I don't think the exact, like, vision for
Okay.
Semantic was planted there, but the conviction that I could build something as a doctor that knew pretty much nothing about business or entrepreneurship, that was born in that program. So that, like, I was exposed to a lot of other entrepreneurs, like, super successful ones that were Canadian that came and talked to you, and very smart, students from across the country. And I think it really just shifted the mindset of me and a lot of my friends in that program to we can actually do this and we can actually go build stuff
Hmm.
and make an impact. And you don't need much but like conviction and self-belief and honestly like a lot of relentlessness and
Indeed, a lot of relentlessness in the startup world. Amit, my co-host, is a big fan of hackathons. He's actually
yeah.
going to one next week, and I think it's a similar concept, just being together with other people, feeding on that energy and taking the time away from busy life, professional, personal, and dedicating some time to innovating and building things. So I think that's really neat, the idea of the next 36. You kind of gave us a high level overview of medical coding, which I realized as I was prepping for this interview I don't know a ton about. But it's always a great opportunity for me to learn, and I'm sure we have listeners that maybe don't know a ton about medical coding as well. So I want to talk about what that looked like pre AI, and you kind of covered
Yeah.
this. So you have a doctor provider writing a note after they meet or while they meet with a patient about like the diagnosis and treatment plan, whatever that may be. And then you have a team of medical coders that traditionally would look at that note and would write the codes, create the
Yeah,
codes to
code,
submit to the
essentially code.
insurance to code to
Yeah.
submit to the insurance company. Is that correct?
Yeah, that's pretty much it. I would say the only other caveat is before electronic health records, all of this was done on paper. So the team would be pretty much in the hospital, like usually in the basement or
Wow.
the health information management department, and there would be a bunch of paper records everywhere that they would be reading through. But with the introduction of EHRs, all of that data was digital, so it's a lot easier now for medical coders and also for AI to read through this data.
Okay. And so semantic health comes in at the point of the provider having written this note, and then you
Yeah.
have AI look at the note and code correctly based on maybe a set of parameters that you've put into the model or something like that.
Yeah, so coding is actually like a bit of a science and a bit of an art. So you can't there's no like set of rules you could give to a model
Uh,
that perfectly get every single code because there's a lot of variability in how the documentation that a doctor writes can show up. They can make mistakes. They can write things in a very vague or unspecific way. They can miss including diagnoses. And then the rules always change. There's maybe 100 to 150,000 different medical codes that you can assign that they're supposed to cover every single thing that could go wrong and every single procedure that you could do in a hospital. So there's so many codes, there's variability in the documentation, and then there's a lot of rules for how to apply codes, like when does a code apply to this patient, when does it not? And it's all dependent on the patient context and what the doctor has written. So it's actually a very difficult problem for a person to do this
mhm.
accurately, which is why there's a whole other industry around auditing and clinical documentation improvement, which is basically like how do we correct the coding and the documentation to make it accurate. And then it becomes really hard for AI to do this accurately as well. But when you marry the AI and the person together, they become a lot faster and more accurate.
Mm, that human in the loop augmentation. That's
Yes.
fascinating. And I'm assuming the outcome of this, of less errors in medical coding, is beneficial for the hospital and then beneficial for the patient as well. Can you speak to both of those?
Yeah, I think the core reason, like ultimately, like why we started Semantic is the data itself in healthcare is not necessarily reflecting what happened to the patient. Like you have no guarantee that the doctor has written the documentation accurately or the codes were assigned accurately. And if you don't have a clear lens into what actually happened to the patient, it becomes hard to action on that data and build other AI on top of it. So my initial vision for Semantic was how do we make sure that the data is as accurate and as clean and as structured as possible so that when AI eventually takes off, we have much cleaner data for us to actually build on top of and enable AI. So that's like the long term benefit. The
Hmm.
short term benefit is the more accurate the data is on a patient, the more accurate the reimbursement is for the hospital. So if you're missing diagnosis codes, you're underreporting the complexity of care for a patient or the complexity of what you've done. So you make essentially you've already spent that amount of money, but you're getting
Mm,
back less. And in the same way, if you're over-reporting, that's also not beneficial either because on the payer side, they're paying more than they should have at the end of the
mhm,
day. So the goal is accuracy and quality to reduce overpayments and underpayments. And then ultimately, with cleaner data, the hospital can just make better decisions for patient care. Like the physicians just better understand what happened in the previous discharge, what
mhm.
happened with this patient, population health can be better informed with cleaner and more accurate data, and then you can just make better operational decisions. So the data really it the medical coding process actually like sees all of the clinical data that a patient will have accumulated in the journey of being in the hospital. So it was like the one step in the whole back end cycle that actually gets all the clinical notes. And that's why we decided to really like intervene there and help augment that process.
I want to dive into the fact that Semantic Health was acquired by AAPC, which you mentioned in what year?
2023.
Okay, so fairly recently, not in the world of AI, but kind of relatively fairly recently. And as you mentioned, Nick, AAPC is the nation's largest education and credentialing organization for medical coders, billers, auditors, practice managers, documentation specialists, compliance officers, and revenue cycle managers. I'm curious, how did that partnership come about and what made AAPC the right fit for Semantic Health?
Yeah, so it is an interesting story, but we started out as technology partners
Mm.
actually. So APC, besides being the credentialing like powerhouse of the coding industry, actually has really awesome software for coders. So
Hmm.
Codify, for example, grouping software, educational resources. That's a growing business line that the AAPC has invested a lot into. And we were looking to integrate the semantic platform with the grouping software and with the Codify software. So we started out as integration partners. We were looking to integrate and partner and go to market with a combined kind of technology offering. And that quickly evolved into a lot more because on our side, what was really exciting was APC was really forward thinking. So they were really thinking about, AI is coming. Medical coding is going to be one of the first places in healthcare where AI is going to penetrate. How do we actually think about the future of medical coding? What does the future generation of medical coding look like? What does a coder look like with AI? Like these were all questions that they were thinking about 2, 3, 4 years ago before AI really, really took off. And so they were forward thinking. They were trying to answer these questions and really be the thought leaders and the innovators with how we actually marry AI with medical coding, with auditing, with CDI. So that was exciting. For them, it was because they were trying to answer these questions and they were really focused on the technology side of the business. We were an exciting opportunity to accelerate, their vision in the AI space and in coding, auditing, CDI augmentation. So we started talking about what it would look like to partner together and what we would do, and very quickly that accelerated into acquisition conversations and really getting to know each other a lot more deeply and understanding each other's cultures, each other's mutual
Mhm.
fits, our vision, and it all ended up aligning at the end of the day. So we both went for it.
That's super exciting and congrats to you on that. Are the members of AAPC individuals, like individual coders, or their organization memberships as well?
The majority are individuals.
Okay.
Some organizations will have like broader memberships for individuals, but the majority are going to be individual coders or auditors or people working in the revenue cycle that initially get credentialed through AAPC. So you can go through and credential, take an examination, get certified to actually do medical coding, and then it's more of a community after that.
Mm.
So you can go to the conferences, complete webinars, credits, educational credits, and meet other people in the community. So there's local chapters, there's national conferences, there's a bunch of stuff that you do as part of the organization to stay involved at the end of the day.
Mhm. At Sidecar, we know the power of bringing the brightest, most innovative minds out there together in person to learn and grow. And that's exactly what we do at our annual conference, Digital Now. Digital Now is a 2.5 day conference bringing Silicon Valley and executive level content to the association space. We bring in expert speakers from places like Google, Amazon, and the U.S. Department of State to share insights on emerging technologies and how they're reshaping the future of associations. Whether you come solo or bring your team to collaborate and implement together, you'll leave with a clear vision for what's next. Join us November 2nd through 5th, 2025 at the Lowe's Hotel in Chicago. To secure your spot, visit digitalnow.sidecar.ai.
Is your association drowning in disconnected systems and manual processes? Symmetry makes IT less scary, including AI. We're the only firm offering secure, vendor-agnostic AI specifically for associations. Early adopters are already seeing dramatic results. AI implementations can reduce manual tasks by up to 80% and free up over 20 hours per staff member weekly. From managed IT services to revolutionary agentic AI deployment, we transform how associations operate. Ready to lead your industry's AI transformation? Visit Symmetry.com for your free AI readiness assessment. Symmetry, AI strategy and agent deployment for associations. That's Symmetry.com, CIMATRI.com.
If you're listening to this podcast right now, you're already thinking differently about AI than many of your peers. Don't you wish there was a way to showcase your commitment to innovation and learning? The Association AI Professional, or AAIP certification, is exactly that. The AAIP certification is awarded to those who have achieved outstanding theoretical and practical AI knowledge as it pertains to associations. Earning your AAIP certification proves that you're at the forefront of AI in your organization and in the greater association space, giving you a competitive edge in an increasingly AI-driven job market. Join the growing group of professionals who've earned their AAIP certification and secure your professional future by heading to learn.sidecar.ai. I feel like across the board, what we hear at Sidecar is we have associations where their members are loving AI, already using AI in their workflows. I'm thinking actuaries being an example of that.
Yeah.
And then we've got many associations where their members are absolutely put off by artificial intelligence. I'm thinking writers, creatives, right? And then those in between. I'm curious, how did AAPC and Semantic Health see medical professionals' reception to utilizing artificial intelligence in the coding process?
Yeah, I think it's also mixed. Like with any, like there's a lot of medical coders out there, and various different experiences and people at different parts of their career. I think there's a lot of excitement and a lot of curiosity about where it can go and how it can help. And there's definitely a large portion of people that are open to using, to testing, to integrating this into their workflow. But there's also people that are worried that this might take over their job. I will put it bluntly, like that's a pretty common concern that I get is, will this replace me? Will this end up taking my job? And if you're a medical coder, my like short and pretty like confident answer is no, it's not going to replace you. As I said before, this, like, being a really, really good coder is an art. And the AI can augment what you do and how you get to the answer, but it's not going to fully automate how you code an inpatient record, for example. That's very complicated with many different diseases and hundreds of pages of clinical notes. Uh, it's not there now, and I don't think it will be there in the near term. It might be there at some point. I don't know how the technology will evolve, but at that point, I think the focus and the scope of medical coding
Uh,
might become more supervisory or more critical of the AI, and more on the training and evaluation side. But I don't think we're anywhere near that part yet. In the near term, really, I think as a coder, what you should be thinking about is, how do I become better at what I do by being able to use this technology? So in the same way that you might be using ChatGPT in your daily life to like plan a trip or or work through something or start a
mhm.
new project, think of AI in the medical coding space in the same vein. It's going to be able to augment you across the stack eventually of what you do, but it's not going to automate you.
Mhm. Do you think there will be less medical coders, though, if AI is kind of heavily augmenting the existing medical coders?
There might be
Mhm.
less like traditional medical coders, but
Yep.
I still think like at least now the way that we build our AI is it's very human in the loop, and we do require humans at the end of the day, medical coders to work with the AI to build, to train, to evaluate, to supervise, and this is in addition to actually completing coding. So there's actually new roles for medical coders for actually building these systems, making sure these systems are accurate, they're not hallucinating. Like hallucination is a huge issue for generative AI now, where we can't really trust what it's saying. And so you do need the domain expert. You need a medical coder in this case to be that final say and to be that authority. And I don't think that's going away like anytime soon. We're not close to solving hallucination in generative models. Like that's a whole other issue, like with the architecture of large language models that I haven't seen a solution to. So as long as that persists, like you're really become even more important to make sure that these systems
Yeah.
are stable and not hallucinating.
I think that's an excellent way to put it. I know we have many healthcare association listeners who are wanting maybe to do something like AAPC has done, but are certainly concerned. If you were an association of I don't know, writers, for example, that was trying to roll out a knowledge agent for your association that writers could use that had access to all of
Yeah.
your resources and educational content, that's one thing. If you have an association of physicians that would like to use your knowledge agent where they put in patient information, that's a whole nother ballgame. So
Yeah.
I'm curious from like the healthcare data side,
Yeah.
it, privacy is essential, right? And so, how did you approach building an AI tool where you could ensure kind of that patient data was secure?
Yeah, that's a huge one. And honestly, the short answer is like it's much harder to do that, and you can't rely on external models. So you can't rely on
Mm.
API
Yeah.
calls to OpenAI, to Google. Google might have like HIPAA compliant models now, but in the past, like nobody really did. So you have to build these models. At least the approach that we took was completely private.
Okay.
So on our own private cloud or even on premise. So we've spent many months sometimes with customers deploying to their own servers, like building and training and testing and evaluating AI on their own bare metal server, which is 10 times harder than, making an API call to OpenAI. But that's the cost of doing, business in a secure and private way in healthcare. And ultimately, I think like you really need to be serious about this because, like you do need to protect the clinical data. And, I've heard horror stories these days of like residents or physicians like pasting clinical notes into ChatGPT
Yeah.
to write notes. Like this is a real problem, and we do need like oversight and like secure and private solutions in healthcare, especially on the clinical side, as these tools become like super easy and powerful for physicians to use for writing notes, for example. So yeah, security is a huge consideration, and you have to put in the time and the effort to make sure that you're doing it right.
But it is possible. It's feasible. Obviously, you've done it.
It's totally feasible. A lot of companies have done it and are doing it, like not
Mhm.
just in healthcare, banking, insurance, like a lot of highly regulated industries will require private, sometimes on premise or securely like cloud deployed instances of AI. And so it's not a new industry. It's just going to cost more for you to maintain, your own server, your own cloud instance versus delegating to an API call, which is
Mhm.
honestly easy to do.
I wanna use the example that you mentioned because I think it's a funny one, a concerning one, but it also circles back to a greater point. So the resident potentially who is copy and pasting patient information into ChatGPT or Claude or whatever large language
Mhm.
model, I'm sure that's happened many a times. I'm sure that it's still happening, even with medical coders, right? I'm sure as ChatGPT rolled out, there may have been some of them that were using it in that way to review their work. I'm curious what you have seen on the AAPC front in terms of educating medical coders around artificial intelligence, because I'm sure when you roll out something like semantic health to them, there is some education learning curve. Like you
Yeah.
need to know what's possible with AI to
Yeah.
understand why you should adopt something like semantic health.
Education, I think, is the most important step for, getting a domain expert like a medical coder to successfully integrate AI into their day to day. And I think education is a few things. The first is like really just getting everybody on the same page about what AI actually is. There's a lot of like noise about what it is, what it does, but at its core, it's a statistical model, like generative AI, at least. Like the most basic way of putting it is it's a model that uses statistics to generate text for you based on text that you give it or data that you give it. And so it's a statistical model and it's not a reasoning model. It's not like a model that can plan or is highly intelligent. It's just it's basically going to be a pattern matcher. And so a lot of education like goes into that step of like what actually is it under the hood, because that determines what it can actually do and where it's going to break and how it's going to hallucinate. So the more you kind of intuit the fact that it's just complete, it's like a very fancy autocomplete at this point, then the more uh, empathy I guess you have for the model, for what it's doing and when it actually doesn't work and how to
Mhm.
actually troubleshoot with it at the end of the day. So understanding the first principles is step one. Understanding like its strengths and its weaknesses is step two, especially for your workflow. Like in medical coding, it's not going to 100% get every single code and capture every single thing in the document. And sometimes it might code something and explain itself in the wrong way. So there's limitations that we have to educate people around. And the third piece is just education in general around um, the future. Like, what's your role? How is your role going to look like? The augmentation versus automation like debate that we just talked about, I think, is a huge part of education and really aligning people with the fact that like this is a tool. Like in the same way that calculators came out and you either use it to do math faster or you don't use it and you're still using your pencil to do math. Like that's kind of the way that I look at this. It's like an intelligence upgrade for you to be able to do more versus it's going to just automate everything away.
Mhm. And I feel like associations are just perfectly positioned for this. On the education piece, they're typically, the thought leaders in their industry or profession, so they can provide that education. If there are any solutions like semantic health that they endorse, they can potentially provide those to members. That's a huge
Hmm.
opportunity for revenue generation. And then I love what you said too about thinking ahead, which is something Amit always talks about, not just looking at the landscape now, that's essential, but when Gen AI in general is moving so quickly, looking maybe a year or two ahead. What does this profession look like? What does this industry look like? And how can we help our members get there? I would argue there's no better organization positioned to kind of help people through this transition than associations.
Yeah, I agree. That's why we partnered up
It
with
was a
a
good move. It was a good move for semantic health.
yeah, exactly. And I think associations are really the educational providers. Like we're certifying at the core, yes, we're certifying and we're providing the credentialing and the exams, but but like we're providing education about how things are changing and where things are going at a time when there might be a lot of uncertainty around the technology and around the future at the end of the day. So I think it's very important to stay close to the associations that you're part of, to be involved and to take part in the courses like AAPC. I think if it already isn't released, has an AI kind of primer course that
Yeah.
we've been working pretty hard on. I'm not sure if it's out yet or not, but these are some of the things that we're focused on.
I'm curious if there are any other, well, there's probably many, but any that you would want to share on the podcast, trend lines that you're seeing with
Mhm.
healthcare and generative artificial intelligence or AI, that you'd want to speak about? Anything that you're looking ahead toward? I mean, I know you're
Yeah.
focused on semantic health. Any other future startup ideas?
I think one of the most interesting things is like how do we use these agents in our day-to-day life to help our own health? Like we focus a lot on physical health in healthcare, but what about mental health or spiritual health? I think a lot of people are naturally gravitating towards ChatGPT for this type of health. I don't know about you, but I've been using it in that way. You know, if I have a strong emotion or like a tricky situation, I do go to ChatGPT for some advice on what to do. And I think I've talked to a lot of people and I've seen some research that shows, this is one of the main use cases of chatbots is kind of like our mental health, our well-being overall. So I think that's a very exciting direction. Right now, I don't think ChatGPT is equipped properly to do it, just with the hallucination. And then secondly, its tendency to confirm pretty much everything that you say. Both of these things can get pretty dangerous if you're using it for like true mental health support,
Mm.
like therapy or counseling through tricky situations. So I think we need better solutions that are more grounded in, clinical guidelines, principles, and therapeutic principles
Mm.
that have the proper context about people and that are private. And I think that's a really exciting area that can help pretty much everybody because access to therapy generally is expensive. It's limited. I think even if you don't have like a true mental health disorder, therapy is like working out for your muscles, but it's for your mind. Like I think everybody can benefit from having these dialogues in general, and eventually chatbots might be a pretty good way of facilitating that access to people across the stack.
I think that I don't know if we've ever talked about that on this podcast in our nearly, 100 episodes, but I think that's so important. And yes, I myself have found myself going to I like to use Claude. But yeah, if I have a thought or an emotion or especially too, I tend to be pretty curious and inquisitive. So if I'm reading a book about something and I disagree with the point, I'll kind of like voice mode that into Claude. Well, I don't really see how that applies to this. And then it'll kind of help me work through that. So I think
Yeah.
there's a lot of opportunity there. But I do agree with you. If we could have a model that was trained on like the DSM and maybe like exactly clinical information around people and mental health, that could be interesting. Is that something you are looking to work on in the future?
I don't know.
Yeah. I don't know. I
Not
feel like
yet.
you're having the
Maybe.
thought, you've got the experience.
I think I like personally resonate with this
Yeah.
because I've worked in the mental health aspect of
Mhm.
healthcare. Like I've struggled with stuff too. Like I know people, and I think like and I've used ChatGPT and I can see where it's like falling apart for this use case, but it's a very obvious like starting point that can help pretty much everybody that has access to ChatGPT. Um, but I have no definitive plans.
You need to do a hackathon or something, perhaps
Yeah,
another
maybe a hackathon.
um, for our association listeners who have been surely fascinated by your story, by AAPC's story, who would love to incorporate a solution like this into their repertoire, who
Yeah.
want to be maybe a little bit more like AAPC, more forward looking, based on what you've seen working with this organization, what advice would you have for associations in general that tend to have, smaller teams, limited technical resources, etc.?
Yeah, working with APC is a great starting point. We do have a lot of knowledge resources and people that understand kind of the coding industry, but also the technical side as well. And it depends on your goals. Like I would say, like have a. I think the most important thing is like just thinking about your vision and your goals and like where you want to take things. I think that has to come from within, as with anything. And once you have a clear idea of hey, we want to try out AI or we want to expose our members to more AI or go in this direction, then you can approach organizations like APC with like a tangible vision, and we're more than happy to kind of explore these things with you at the end of the day. But having a clear goal, clear vision, and um and you don't have to do it all, especially with AI. Like I don't think that there are like experts running around that know AI everywhere. There's a lot of people that are using it and are building expertise, but like true expertise from the technical level, from the practical level, that's still very rare. and organized like larger associations like AAPC, at Semantic. That's all we've been doing for the last 8 years, or not 8 years, 6 years now.
Yeah.
Or so. So reach out to people like that. We're not the only ones. There's other associations, other companies, researchers at universities. There's a whole bunch of people that really know what they're doing and that are more grounded and less kind of hyped about the tech. They're still excited, but not hyping it up unreasonably. I think those are the types of people to seek out for like a grounded perspective.
Yep. And when you encounter people in your personal or professional life who are a bit more cautious about artificial intelligence, which is fair, or even
Mhm.
perhaps against it totally, what do you typically tell them?
I mean, I'm also cautious about it from the point of view that like it's a statistical pattern matching machine now, and we're applying a lot of like abstraction to it and kind of like meaning to it and anthropomorphizing it, to be honest. And I don't think it's as smart as we think it is right now. It's gonna get better, but like there's a certain level of caution you have to take when you do this because you start applying it in different ways that maybe it shouldn't be applied, with some level of bias or blindness about its actual like effectiveness and reliability. So I think you should always be cautious about AI, but I also think it's gonna be the most impactful technology ever, like in our species, in our history of our species, if we build it out properly, because it's an intelligence like level up pretty much for everybody, uh, and like it's going to be exponential at some point. So it's going to enable a lot of other fundamental discoveries over time, as well as you and your daily life to just be much higher quality. That's the vision I hope we go down, but but we have to be cautious because like this technology is pretty powerful now, and it can get a lot more powerful. So we have to build it in a responsible, ethical way. Make sure that it's aligned with us, and and really just focus it on things that matter. At the end of the day, like healthcare for me is the thing that matters. So that's why I'm focused on that space.
I think that is a very healthy outlook. Being cautiously optimistic, we like to say that we are both of those things on the Sidecar Sync podcast. Nick, I've got to say, thank you so much for joining us today. This was a really insightful conversation for me, for our listeners, I know. And so we really appreciate your time, and we look forward to seeing what's next for Semantic Health on the
Thank you
horizon.
so much, Mallory. It's been a pleasure. It's been super fun, and I hope you guys enjoyed.
Thanks for tuning in to the Sidecar Sync podcast. If you want to dive deeper into anything mentioned in this episode, please check out the links in our show notes. And if you're looking for more in-depth AI education for you, your entire team, or your members, head to sidecar.ai.